I worry about melanoma in the nail, skin cancer of, the nail bed. So be cautious about going in all the time. My daughter wants to do gel, and I absolutely will not let her, because imagine starting gel manicures at the age of 15 or 16. Welcome to the More Than a Pretty Face podcast, where we go more than skin deep to explore the science of beauty and help you feel your best at any age. I'm Dr. Azi and Nurse Lacie, a board-certified dermatologist practicing in San Diego. I specialize in surgical and cosmetic dermatology. And this is Nurse Lacie, who is also my co-host and my real nurse in real life.
Yes.
So welcome. We have a really fun holiday episode planned for you guys today, where we are going to play Spotify Wrapped. But no, it's not going to be Spotify. It's going to be skincare wrapped. We're going to put our own twist on it. If you guys don't know what Spotify Wrapped is when Spotify lets you know of your best songs that you listen to all year. It kind of gives you a like a wrap, like this year's wrap. So we're going to do that in place of our beauty and blemish.
Yes. And we're going to play Santa Slay all day, where you give us your fave.
Yes, and then nay, nay, nay. So instead of slay or nay, we got really creative on this episode. How's everything? I feel like I haven't seen you. The office has been so busy.
It has been very busy, but I'm good. Yeah, I'm super excited for this episode.
Everyone's getting holiday ready, and I'm so glad we get to take a little time out of our crazy schedule and sit on this couch.
It's very comfy.
Tea going on over here and talk about the holidays. Catch up. I love it.
Yes.
Okay, so what are we getting into first?
Okay, so you kind of touched on it. Spotify at the end of every year kind of goes over your favorite songs and artists that you've been listening to, and so I wanted to incorporate that with this episode for Skincare Wrapped, where we'll talk about new innovations, our favorite skincare trends, just kind of count down our top faves.
Let's do it. Okay, top 5. Okay, number 5, I'm going to say Volux.
Yes. Tell everyone what Volux is.
I'm obsessed with Volux in the office. So it's the FDA-approved filler this year for jawline. Mm-hmm. Now, you guys may have heard about Voluma, but Volux actually has triple the cohesivity and double the G prime. And these are filler characteristics, which basically means that
Layman's terms.
Yeah. It is a robust filler. So if you are trying to shape, the jawline, make it more defined, make it straight, it just has such power to it, and it lasts a long time. I've really been loving it for jawline, some for the chin.
In the right candidate,
because again, it is one of those robust fillers, but I've also loved it for the cheek area. It just holds things up really well, and you can mold it at the same time. So it's been a game changer in our practice. I've been really loving it.
Yeah, it's been a fan fave for sure.
Okay, what's number 4?
Let's say number 4, the year of Ozempic.
Oh, yes. That has been huge. I know so many people on Ozempic. And you know what? Not only does it make you not want to eat, so you lose weight, but it also makes people not want to drink or have junk food. And they're just happier.
Yeah.
And because they've never been able to lose weight. And here, this miracle drug, but it hasn't been great for the skin.
No.
Let's be honest. That rapid weight loss takes out all the support and structure from the skin. So we've been seeing some saggy skin.
Yes. Yeah.
That's the only kind of bad part about Ozempic, is it's causing a lot of droopiness.
Yes.
So we've been doing, some remediation with that, helping those patients out with replacing, volume with fillers and things like that. But it could take some time. The younger you are, I feel like your skin can bounce back. It's almost like being pregnant, and then all of a sudden you have a baby. And, and so you have to be careful not to lose too much weight too fast, because you don't want to, cause a lot of that
I would say
support
too, wasn't it it became so popular that it was really hard for a lot of like just aesthetic practices to even get it, like the weight management like aesthetics.
I mean, weight loss should not be aesthetic, right?
Well,
It
you
should
know
be
those
for like
med
people who have.
spas that do everything, weight loss and Botox and fillers.
Well, there was a shortage. Yeah, you're right. Well, now there's a new drug. There's a new FDA drug. It's called Zepbound. That's going to be the competitor for Ozempic, because honestly, there wasn't enough Ozempic to go around.
Great. Now that one's going to be out of stock soon.
Yeah. And what's interesting is Dr. Mary Claire, who's a menopause hormone specialist, an OBGYN, she's predicting that we're going to see this whole surge of babies being born to people that weren't previously able to have babies because of weight, because of
because
their
they lost weight
and the hormonal changes that come with that, and people with diabetes who had a hard time getting pregnant. Now they lost all this weight, their hormones are back to high functioning state, and their bodies are healthier, and so
a baby boom.
We're gonna expect a baby boom. All right, so number 3, I would say, has been the AviClear acne laser, which has been a new addition to our practice. A lot of people don't want to go on Accutane or take oral medications. Well, AviClear has been really a great option. It works almost exactly like Accutane in that it targets the oil glands
without the side effects.
Yeah, without doing the blood work and the potential side effects and things like that. So it's 3 sessions. You got to do it every 3 weeks.
Yes.
What I've found challenging with it is having patients telling them, look, you may not clear for like 3 months, 6 months.
Yes.
And that's kind of the case with Accutane too. Sometimes we don't see clearance at 3 months. Now, some people do, like after the first treatment, they're already better, but not everybody. So you have to be patient, and you can purge just like you do with Accutane.
With all acne medications. I feel like acne in general is just such a difficult condition, and you have patients that are usually on the younger side that maybe don't have the patience you need to really get through the regimen and trust the process, because you do purge, and it's hard for people suffering with acne to get worse before it gets better. But
there's no perfect solution. There's no perfect solution. It can be expensive as well.
Yeah.
It can also be a little uncomfortable, although most patients in our practice, we use Pronox, which is the breathable anesthetic. They do really well. So if you're looking for an alternative to Accutane, then AviClear is a good option.
Yeah. I'm going to say number 2 is going to be like your fan favorite, exosomes. You hated them. Now you love them.
I am obsessed with them. Let's just not say love, but obsession with exosomes.
Yeah, this is true. Obsession is true.
Well, it took me a while, right? Because when anything comes out on the market, I'm so conservative, because I've been around for quite a while. I'm old, guys. Where I've seen things hit the market and it's supposed to be the latest, greatest thing. And next thing you know, there's like all these side effects and these problems with it.
And that's what I love about you.
So we wanted to try different brands and things like that. But exosomes, if you go back, listen to our regenerative medicine episode, we go really into detail. But essentially, we used to think they were trash.
Yes.
But now they're treasure, and that they work similarly to stem cells, and they help with skin regeneration and rejuvenation. They've been amazing for my laser resurfacing patients. They heal faster, their results are better, and amazing for scars.
Yes.
And so I've been having a fantastic time.
Yeah, heyday.
with them. Heyday, what is that?
Yeah, you're having a heyday.
Like heyday? Like what is that? What is heyday?
I don't know. Maybe it's a Midwest thing. I don't know what a
I
heyday
grew up
is
in the
now
Midwest.
that you say that. It's just heyday.
Heyday.
You're having a heyday.
Hey, like hey, y'all.
I don't know. All right, somebody help me.
Okay,
yeah.
Well, heyday. I'll take it. Maybe I'll use it now. Heyday.
Yeah, you're having a heyday.
Okay, it was a heyday today in the office. A lot of exosomes happening.
I'm from Ohio, okay?
I'm from Kentucky.
So you should know.
Transplanted. Anyway, we digress. Moving on.
Number 1.
Number 1. I would say the non-laser tattoo removal.
Yes. Tell us the great
So
news.
if you guys are not familiar with TERP, which is a new technique for removing tattoos, which TERPs, not the kind that you get your prostate removed. Okay, that's a different TERP. But that TERP is transepidermal pigment release, which means that we use a device that gets the tattoo ink out of your skin.
Yes, it's amazing.
And the reason I have been loving this technology is because a couple of years ago, the EU actually banned 4,000 inks because of safety measures. And we know that laser tattoo removal, first of all, doesn't actually remove the ink directly from the skin.
Right.
Like TERP does. And so what it does is it uses heat, it shatters up the ink under your skin, and then it's up to your body, your lymphatic system to gobble up all this ink, and then it circulates through your system. It has a total heyday, okay, with the ink. And
whatever.
It can end up in your lymph nodes, and there's like all these reports of sarcoidosis and all these things with tattoo ink. So what I love about this technology is that it actually gets the ink out of your skin. It doesn't just shatter it. So
you guys, I'm living proof. I have done
that's
it.
right. She has it. We did her first. She was one of the first ones.
I was one of the first.
And I have to say, our paper got published
Yes.
in the Journal of Drugs and Dermatology, which
so
is
exciting.
A dermatology journal. And we published a paper on our technique of using this new way to eliminate tattooing. Because, you know, back in the day when I was at our laser center, we had like 10 different tattoo lasers.
Yes.
And it would take 10, 20, 30 sessions of tattoo removal. And even then, you can still see an outline of the tattoo. And if you had colors like blue, green, red, forget about it. I mean, it was over. I mean, lasers couldn't even touch that.
Yeah.
But this new technique actually doesn't matter what color the ink is.
Nope,
it just gets
blue.
the ink out. And I think that's the benefit.
Yeah, I love it.
Well, this was fun.
Yes.
I learned a new word today. Okay.
Before we get into the questions, I want to know, what would you ask Santa to put in your sleigh?
First of all, I've been really good this year. Okay, no naughtiness. Okay, no naughtiness. That's good.
If you say so.
Yeah, all the articles, news articles have been positive. There's been no controversy. So.
No canceled from TikTok.
So one of my gifts came early this year.
Yes, you guys.
Yes. It's the Agnes. I have been
How could I forget?
Having my eye on this device, and I'm so excited because, I love doing upper blepharoplasties, but I don't do the surgical removal of the fat pads under the eyes. And so I send those to surgery, and a lot of times patients don't want to go. So I found a device that removes them without cutting the skin.
Yes, tell us
so
more.
Excited.
How does it work? How does it work?
Well, I really want to do a video, but I need to get some like pig fat or something that I can use to demonstrate, like in, you know what I mean?
We should have a pig roast for Christmas.
No,
and then
I
you
need
can practice.
pig fat, not the roast.
Oh.
It melts fat. I'm trying to explain. So it uses these little probes. And I just have to do the demo, but it melts the fat without really cutting the skin or doing anything. So it's like great for like, we all this? I want to do mine.
What?
No, I have it.
No,
you can pinch it.
No, you can't.
So we all accumulate fat here.
Then you can do mine.
And we all accumulate fat here as we age, now to different degrees. And so it's great for those areas. It can also remove syringomas, oil gland enlargements. So I'm just going to have a heyday.
A heyday, you guys. This is
It is going to be one of those heyday moments for me. Okay.
Thanks.
Okay. And then my second item on the list. So I did Sculptra on myself in like August.
You guys.
I did
on
it
herself. Again. Do you know how?
I know, but I'm so scared of Sculptra and that because it's not reversible, right? So I really wanted to do it myself so I can have complete control.
Imagine that.
And I was so conservative, and I injected such little amounts.
Define little.
I mean, very dilute and very little. And just in the temples and the sides of my cheek.
Oh my God, you did your temples too?
Yeah, just a little.
Only the high-risk areas, no big deal.
And I was very careful, very seasoned, so don't try that at home.
This is true, you guys.
So I'm waiting for it to kick in. It's been about 2 months, so my wish is by December, by Christmas, that you can start to see the results.
Your skin has already shown the results. You've been glowing. Your skin looks
maybe
so
it's coming in. Maybe the glow is coming in.
Now
anyway.
I know it was Sculptra.
So my last wish is that I really want to start an organization where I donate skincare and beauty products to
Yes.
people who don't have as much as me, because right now
We talked about this.
I
love
have
this idea.
mounds and mounds of skincare PR packages and makeup, and I just physically I can't get to all of them. And every time I look at them, I know that I need to unbox them, and it gives me so much anxiety because
You do, literally.
I feel
guys.
so bad. You know, there's like people out there that are crushing Advil and putting it under their eyes for an eye cream, and I could be giving them.
Somebody could have a heyday with this.
Yes.
Because the mounds is not even a joke. Like,
Yeah.
she could stack a whole room.
Yes. So
full of
that is
skincare.
my dream. The only problem is I don't have any time to start a foundation. So what we're going to do is I'm going to put my kids to work, and I'm going to put the office to work, and we are going to donate them to a domestic violence shelter for women and do like a little shopping spree. But I also want to help, you know, with teens and, you know, those people that are less fortunate. I feel so bad with all this skincare just sitting there, just looking at me like, you
Just
know,
looking at you.
there's just so much skincare and beauty in this world, and they're all coming to my office.
Both offices.
So yeah, so that's the third on the list. That's my wish list.
I love it.
Donate
Those are great.
to a good cause.
Do you want to jump into Ask Dr. Azi?
Let's do it, because I love hearing from you guys. If you have questions or you want to send me a message, send us a DM on Instagram at More Than a Pretty Face Podcast or at Skin by Dr. Azi. You can also email us if you're not on social media, More Than a Pretty Face Podcast at gmail.com.
But who's not on social media?
All
Okay,
the
first
happy
question.
I'm just kidding. No, that was just a joke.
We're keeping that. And so our first question. Hi, Dr. Azi. I was thinking about going in for a non-surgical nose job to boost my confidence before the holidays. I have a bump and would like my tip to turn more upward, and she wants to know, what should she be asking for? What kind of filler should she use? What should she expect? And I mean, these are kind of questions for her doctor.
Yeah, it's true. But I love the non-surgical nose job, especially if you have a hump that just needs to be masked. Those are the perfect candidates. And by by placing the filler, you know, along the bridge of the nose, we can also change the angle of the nose, and we can use it to make the tip look more upward.
Right.
Change the angle of the tip. It is a very, very high risk area. So you really want to go to somebody with a lot of experience that has techniques down to reduce the risk of vascular occlusion. And that is when you get the filler in a blood vessel, because it's a highly, highly vascularized area. And the blood vessels are connected to the blood vessel that feeds oxygen to the eye, which means if you block that vessel, you block the delivery of oxygen to your eye, and you can go blind. So you have to be really careful. And it's really important to place the filler. I personally favor the micro aliquot technique, which means small amounts in different planes in the different areas you're trying to fill. That looks the most natural. It gets integrated better with the tissue. In terms of the kind of filler I prefer Restylane or Volbella. Those are not hydrophilic, so they're not going to make the nose look puffy. They also don't tend to migrate, you know, as much as some of the other fillers. They're not very cohesive. So yeah, those are the ones that I personally like to use. But I think I agree with Lacie. You should ask your doctor.
What about Bellatero?
You know, I love Bellatero for like subtle lips or subtle under eyes, but I don't think it lasts very long.
Oh.
And it doesn't have enough oomph, you know, for the nose.
Yeah. What about Alex Earl? Did you hear about her Accutane nose job?
A lot of people. Accutane nose job has been trending this year. So yes, Accutane can shrink your nose. And I say that in quotation marks because it doesn't actually do anything to the structure of your nose, like the cartilage or the bone. It just shrinks the oil glands. And because the nose has so many oil glands as the bulk of the tissue of the nose, it can shrink the nose in a sense that if somebody has a lot of oil glands, they go on Accutane, boom, their nose looks slimmer, the pores look tighter. In fact, a lot of plastic surgeons, after they do a rhinoplasty, a nose drop, will put people on Accutane like 6 months later, because with surgery you get a lot of swelling and you can get this hypertrophy of the oil glands, and you can get almost a sebaceous nose, this like oily, thick tissue on the nose. And in order to give them that slimness, that definition, that contour, they'll put their patients on Accutane. And I've done it, for a lot of these plastic surgeons. So I think it works really well. But not for everyone.
Yeah. No, obviously.
Your nose does get a little slimmer, though, as you get older, because you lose fat. Just like you lose fat everywhere else, you lose fat in your nose.
So it'll look more pointy?
Yeah, it looks a little bit more slim. I mean, my nose is still big, but,
No.
It's smaller than it was, maybe.
Okay. Well, that was a great question. Our next one is, hi, Dr. Azi. I suffered from eczema for my whole adult life and have been prescribed a topical steroid to manage it. However, my results, even with the steroid, are not great, and I'm ready to try other options. My fear, however, is topical steroid withdrawal. I've seen images online that look horrific, and I'm wondering if I will have to spend my holiday vacation in hiding while I come off of these steroids. Why does this happen?
Aww.
Can I prevent it? And what would you recommend for me?
Oh, my heart goes out to eczema patients, especially really the typical ones that have suffered most of their life with it. I mean, a lot of times you outgrow it. We see the kids with it with severe eczema, and then, they're better by the time they're an adult. Eczema is a chronic condition, and it's really challenging. Steroids are not always the answer. There are great treatments now. And the reason you get this steroid withdrawal syndrome is because you have inflammation, and that's just the nature of your body. Your skin is to be inflamed and be, triggered by anything and everything sensitizing. And so while you're on the steroid, of course, it is keeping things at bay. But when you remove the treatment, things go back to the way they would have been without any intervention. So now there's Dupixent, which has been a life-changing for patients. I mean, it's not something that I do because I don't specialize in eczema or medical dermatology, but I can tell you that for patients, Dupixent has been life-changing. I actually just put somebody on it who's like a colleague, friend. I said, look, we can't keep doing these steroids. You're coming in for these steroid shots. You keep applying the steroid cream. After 2 weeks, I tell you to stop, and boom, it comes back. Chronic eczema is not healthy. So the dose, the treatment is, despite all the side effects of steroids or Dupixent or any of these treatments, it's still better than the disease. So I think it's really important to see a medical dermatologist, have that conversation, and ask them about some of the newer therapies that are steroid sparing. Other things would be like Imuran or cyclosporin,
what about
or light therapy. Well, Eucrisa is just another topical, but it's a non-steroidal anti-inflammatory. Again, depending on how much you have. I mean, you'd be like taking a bath in Eucrisa. You need like tons of tubes of it. But there are lots of steroid-sparing oral and systemic agents. And then light therapy. I'm probably going to get canceled for this.
Never.
But
not you.
If you get a little bit of sunshine between the hours of 11 a.m. and 1 p.m., UVB rays are actually, can be anti-inflammatory. So a little sun, I'm not talking like 20 minutes out there with no sunscreen. I'm talking about like 3 or 4 minutes of, direct sun exposure on the eczema areas.
Everything in moderation.
That's right.
When we, before we opened the private practice, we worked with a doctor that was very big on,
light therapy.
Well, psoriasis, eczema.
Psoriasis.
So just having the experience of starting patients on Dupixent, I will say that paperwork and prior authorization from office side was just whew.
Well, the insurance and healthcare, that's like a whole other
episode.
A whole other podcast, I should say.
All right, our next question. They write, hi, Dr. Azi. I was thinking about splurging on breast implants to boost my confidence, but paused when I heard you talk about getting yours removed. Will you talk a little more about this? And also, I am hearing about bee pollen to make your breasts grow. Is this scientifically possible?
Okay, the bees and the birds.
Let's start with the bees. What? I have not heard this trend.
Yeah, I saw an article in Forbes actually that talked about how social media is suggesting, bee pollen grows your breasts. And I PubMed that, which is the Google version for scientific journals. And there's been no evidence
Are they rubbing it on their boobs, or
I
are
think
they
they're
eating
taking it. They're taking supplements because pollen is how plants reproduce, right? The bee gets on the flower and then spreads the pollen. And
thank you for that.
And so, so taking that, I don't know who came up with this idea, bee pollen for growing breasts. But you should note that your breast size actually change every day.
Well, yeah.
I mean, based on your cycle, your hormones, some days they might be fuller, like right after ovulation when your estrogen peaks, your breasts are going to be fuller. Maybe that's just evolutionary so that, you get your man's attention that you're ovulating. And so that can just be coincidence.
Yeah.
People say, oh, I've been taking this and, now I got bigger boobs. Well, maybe because it's that time of the month, or maybe it's because of your hormones.
Something else, yeah.
Maybe you're on birth control pills or, if you're taking...
Or spironolactone. I mean, that's the true magic
maybe you've got hormonal acne and your dermatologist put you on spironolactone and now you're like a cup size bigger, which happens.
Goals.
So it's a little bit more complicated than that. Breast implants is a personal decision. I'm actually really excited. We're having a plastic surgeon come on who specializes in breast implant syndrome, which is huge, with people who have breast implants. And it's not for everybody. And once you decide to get breast implants, just know that you're going to have multiple surgeries.
It's a lifelong commitment.
It's a lifelong commitment. But, all of this aside, big boobs are out. Small boobs are in. I mean, that's the trend right now.
That's just
it's
life,
like you can wear
it's
more slutty things and not look slutty when you have small boobs. Like when you have big boobs, you can't, anything you wear that's a little low cut, you're going to look slutty.
Yeah.
So with all the trends of like cutouts and like a low cut, dresses and fashion, the way fashion's going, I would embrace the small boob.
Yeah.
I don't think you need big boobs.
I mean, you can wear low-cut things and look sexy and not slutty.
Well, you know what I mean.
Just
some of the cutouts, if you have big boobs, honey, no one is going to be looking at anything but your chest.
Yes, this is true. This is true.
So that automatically, in our world makes you look slutty, I guess.
Yes.
I don't know. Well, I've always had large boobs and I've always been self-conscious of them. But when I had my kid, I was like, who is this person? I don't know her. And
did they just disappear?
Yeah, they did. Yeah. And not in a good way.
Yeah.
They weren't like small boobs when you're 15. They're like,
My cousin never had breasts. And so after she had her first child, they were like negative breast. Yeah. And I just remember thinking, like, she came to me and she was like, I really want to get my boobs done.
Yeah.
And I was like, absolutely. Like, I can understand how you would want.
Yeah, I think we just need to embrace our bodies in different stages of our life and not try to, get ourselves to this ideal image of what we feel like is perfect.
Exactly. Yeah. I mean, just be happy with how you are
Yeah, it's
made.
like, it's kind of like, people talk about, the lip ratio. The most aesthetic pleasing lip is when the upper lip is, a third smaller than the bottom lip, is supposed to be 2/3 bigger. That's not necessarily true. There's lots of women that their upper and lower lips are equal size and they're gorgeous.
Yeah.
So I think we need to move away from some of these beauty standards.
Standards, for sure.
I digress. We were talking about boobs. Now we're talking about lips.
Kentucky.
So. On to, guys, Santa Slay all day.
I just want to give our listeners your top 3, like, anti-aging Christmas list must-haves. Like, what's on their list that they need to have?
I love that.
Like, Santa Slay all day.
Well,
your number 1.
I have been obsessed with LED face masks lately.
This is true.
And the reason being is I do feel that they do make a difference.
Yeah.
I'll tell you some examples. One is I have my patients that are super stressed and it's affecting their skin. And I tell them, put this mask on for 20 minutes. Now, mind you, they have to have the mask on, so they can't do anything like go on social media or pick at their skin or whatever, stress about their life events. And so I have them wear it and I tell them to meditate for like 20 minutes.
I like that.
I tell them to do that 3 times a week, and they do. And just that being under that light has been very therapeutic. But aside from that, there are skin benefits. I do think that it does help promote collagen. It stimulates your skin to form TGF, which are these growth factors that are being produced, and they help with collagen synthesis. And it also helps calm inflammation, calms the skin. For my acne patients, I have them do the blue light and the red light, because blue light helps with acne, red light helps with inflammation and collagen, and helping, with acne marks fading faster. I don't like them for melasma or hyperpigmentation, because any type of light, as you know, can cause pigmentation to get worse. But if you don't have melasma, go for it. I love it.
I love that you said that you do that for when you notice patients with high anxiety or stress, because I will say, and I know you don't want to hear this, but when I loved tanning beds, I really, that was my calm. Like, I loved just like no music, just laying down, the heat, the relaxation. You get to like think about your day or think about like uninterrupted 20 minutes in the tanning bed.
Yes.
And
so
I
now,
may or may not
now,
miss
now
that,
you don't
but
need to go to the tanning bed. Now you can just use the LED. And everybody else asks me, like, what are some good ones? I really like Omnilux. They have a lot of science. They've done some peer review studies, and so they're one of my favorites. Cure is another one. Dr. Dennis Gross has a great one, as well as Current Body. Current Body, actually, I like their neck and chest one.
Yeah.
We have one in our office from them as well. And so those are all great. Now, they're a little different price points, but see which one you love. They even have the wands, that you can do. But when you do that, I guess you have to sit and manually rub that on your face. I personally like the mask ones. You can also listen to our podcast. Hey, if you're listening to our podcast and using an LED mask, take a screenshot, send it to me, because I'd love to see it.
Tag us, please.
But yeah, you can listen to a book, a podcast. So I think they have a lot of benefits, above and beyond the skin.
Yes.
They go more than skin deep, kind of like
us.
Our podcast. Okay, number 2 are at home mani pedi gift sets. I think those are really fun and really beneficial, because maybe you can save money doing your own nails, but also save your nail and skin genetics, because
from the UV light.
UV light has been shown to harm the genetics of our skin cells. So I worry about melanoma in the nail, skin cancer of the nail bed. So be cautious about going in all the time. My daughter wants to do gel, and I absolutely will not let her, because imagine starting gel manicures at the age of 15 or 16. So you're going to have decades of DNA damage that at some point is going to translate to cancers and all kinds of things.
Yeah, it's scary.
So I think that's great. You could take a little break. And then, of course, Azi MD Skincare.
Yes, please.
To target your specific concerns. I love that we have formulated skincare regimens, because a lot of people don't know where to start. They get a product here and there. They don't know what they should use for different skin conditions, such as eczema, hyperpigmentation, acne, rosacea. So we have done all the guesswork for you, formulated regimens that actually last for several months. And you can just follow the routine, and you can look up and see what kind of skin concern you have, what kind of skin type. And so check it out. Speaking of Azi MD Skincare, we have a special offer only for our podcast listeners. So thank you for your support.
Yes, thank you.
In fact, our team has gone overboard. They've been so generous with you this holiday season. There are 3 things you need to know. Now through December 31st, you can use the code WRAPPED15 to get 15% off individual products at azimdskincare.com. In addition, from December 1 to December 25th, we're offering an extra 10% off of all regimens and duos, which are the perfect gift because they come with a little cosmetic bag, which I
Yes.
love. And then even better, number 3, you can get free shipping for U.S. customers from December 11th through December 15th for all you last minute shoppers.
That's amazing, but you
Yes.
left out the cutest part.
Yeah.
Our ornaments.
Oh, yes.
Yes, their
How
little
cute.
mini
That's right.
cleanser, the purified cleanser, the mini
Yes.
glow serum, which is my personal
These are
favorite,
so cute. I'm obsessed with these.
and a mini intense recovery.
And they come in this little black box. I love that.
But you guys, it's only while supplies last, so
That's
get
right.
yours today.
It is a limited quantity.
They're the perfect little gift, even though I'd want to keep mine.
I know. And the staff has been working so hard behind the scenes to get this ready for you guys.
Yes.
So check it out.
Okay, so we've been getting a lot of questions from our listeners wanting to know if you would buy these things. So I figured we'd wrap it up with your response.
Nay, nay, nay.
Nay, nay, nay.
Instead of slay and nay. Okay.
Okay.
We're going to have a heyday with this,
We're literally having a heyday, you guys. Okay. So things that you would buy or skip. What do you think? Like microcurrent toning tools?
I mean, I don't know if they really do anything. A lot of these devices like the gua shas or, the wands and the new faces, they're kind of expensive, but literally you could use a spoon, a cold spoon or an ice roller. And it'll probably give you the same results. The reason they work, and you see these videos online, and it really does show that it lifts. Yeah, right? Legit, really. No question. For an hour. That's the part they don't tell you.
Got it.
It works for an hour because what happens is the reason they work is we all get lymph fluid. We get just puffiness here because this is just where it all goes. It goes right down here. So what these devices do, you're basically moving. So if you look at my face, I get this droopiness here.
Oh my gosh. Stop.
And so, I actually got a little abrasion of doing this to myself the other day, but you want to, moving the lymph out of your skin like this. And so I do this when I apply my serums and creams. And what you're doing is you are moving the lymphatic fluid out of this central down area. And you will notice a definite lift, and even along your jawline, if you just move that lymphatic fluid back. And same with the under eyes. If you got eye bags and puffiness, move that lymph over like this. I use the Eye Glow AM, that cooling tip of the Eye Glow AM to do that. I don't have a new face, but, so it doesn't hurt, but I feel like it's a little overpriced, and you could probably just use your hands when you're applying your creams.
Nay. Okay.
Okay.
So what about the blackhead remover, pore vacuum?
Oh my gosh.
The ones with the camera? Why would you want the camera?
Definitely no. Well, the camera is just for pure satisfaction because you get to see all the sebaceous filaments and all the gunk and debris satisfying? People have built an entire career off of channels that just show that.
That's true. Pimple popper. Yeah, that's true. Okay.
So, but they're dangerous. Actually, I've seen a lot of people come into my office where they've got scrapes from the vacuum. They have blood that accumulates under the skin, bruises that then leaves them with discoloration and broken capillaries.
With rosacea.
Patients with rosacea using it, that makes their redness and their broken capillaries worse. So I think they can do more harm than good. Okay. So that I would say definitely nay.
Okay.
But if you're going to be a naughty person and use them anyway, I think that you should
get the one with the camera.
Well, okay, the camera, but whatever. But use the low vacuum. Okay, low vacuum, and just do the nose because the nose is just a little bit stronger skin. Don't go for under your eyes or anything.
Interesting.
So, but that's overall just nay. Just don't do it.
Okay. What about at-home IPL laser hair removal systems?
So some of them are getting better. I did review one by a company called Ulike, and they have a sapphire crystal that they chill so that it reduces your risk of getting burned. But they're definitely higher risk if you've got darker skin because the target for those devices is melanin, which is what's found in hair. That's the target. Well, if you've got dark skin, well, guess what? The other target is your skin that gets burned and destroyed.
Yes.
So be careful with those. I would do a test spot. You want to make sure you're not tan and you don't go over, moles or cuts or wounds when you're doing this. And just, test a little small area. Make sure that it doesn't get hot. Make sure that it has a chilled tip. They're very, very mild. So I think they're great for like maintenance.
Yeah, I was just going to say.
You almost have to do them so often and for so long to see results. So just be mindful of that. They're great, in between your laser appointments. But yeah, they're not for everyone.
Yeah.
Yeah. Ulight is a good one. I'm familiar with their device.
Well, noted.
All right. Well, this was so much fun. We want to wish you guys a very happy holiday season.
Yes.
Remember to eat your berries, take off your makeup, and be sure that, you're not drinking too much. And if you are, make sure you're chugging enough water at your holiday parties and have a heyday. With your sleigh and, a happy holiday season. More importantly, I wish you health and happiness. That's at the end of the day, as long as you're healthy, be grateful because you never know what life feeds you.
Yes, and great skin.
Other than berries. Okay. All right, now I'm not making
All right,
any
you're
sense.
cut off. All right,
I need to go to lunch. I'm getting hypoglycemic. Okay, guys, thank you so much for joining us. We love hearing from you, and we so appreciate your listenership.
Yes.
Bye. Bye, guys.
To boost my confidence. Okay, Google heyday.
No.
So heyday is like when people say back in my heyday, it's like a time of their
Like
life
when they were
was
crazy. They were having a great
It
time.
was awesome. Yeah.
Dr. Azi learns a new word. God help us.
Dr.